In June 2018, the latest revision of the International Classification of Diseases, ICD-11, was released for preparation of implementation by the World Health Organization. In this presentation, I'm going to briefly summarize the main diagnoses that are included in ICD-11 from the substance and addictive disorders perspective. And I'm going to compare and contrast with those which featured in ICD-10 and also to some extent those which occur in the Diagnostic and Statistical Manual of the American Psychiatric Association, known as dsm-iv. I'm John Saunders, and I have been involved with the development of the International Classification of Diseases since the mid-1980s, including the development of ICD-10, which was published in 1992. It is therefore over 25 years since ICD-10 was published, and the schedule for publication of ICD-11 is that it will be presented to the World Health Assembly in May 2019. I should emphasize that I've never been a staff member of the World Health Organization, and I cannot therefore speak for that organization. But I have been involved in this area over many years, and I can present the diagnostic entities and also reflect on what they are and how they have come to be developed. The purpose of the ICD system is several-fold. It's a compendium of disorders of human beings. It includes definitions of these disorders and diagnostic guidelines. It covers the whole spectrum of human disorders, including mental health, substance use and behavioural disorders, and physical health disorders, disorders due to trauma, and also health risk factors. Its primary purpose is an aid to clinicians assessing patients or clients and making these diagnoses. But importantly, it is also intended to be of value for epidemiological studies and for disease monitoring from region to region in the world and in regions and countries over time. It is also intended to be helpful for training of students of the health professions and postgraduate trainees, and also to be of assistance in the prevention of disorders and harm from these disorders. The diagram that you can see is a conceptual structure of substance use and addictive disorders in ICD-11. Broadly, you will see that there are disorders due to substance use on the one hand, and disorders due to addictive behaviours such as gambling and gaming on the other hand. Within the group of disorders due to substance use, there are three disorders which reflect a repetitive pattern of substance use. These are called informally substance use disorders, and the most severe of these disorders, and the disorder which is often called the master diagnosis in the substance use field, is substance dependence. This overlaps with the concept of addiction by about 90%. Substance dependence is defined as a disorder of regulation of substance use. It arises as an acquired disorder in the mesolimbic system of the brain and is a response to previous repetitive exposure to a substance. The central feature is most conveniently understood as a powerful and primitive internal drive to use that substance and to continue using it. There are three central features of substance dependence. The first is impaired control over substance use, which means that the onset of substance use may be inappropriate, the amount of the substance which is taken is excessive, and people have difficulty in ceasing the use of that particular substance. The second feature is known as salience, or a priority of substance use over other activities, enjoyments, necessary activities and responsibilities. With the development of dependence, the use of that substance increasingly takes centre stage in that person's life, and those other activities are pushed to one side. Substance use can continue even though the person has experienced significant harm. The third central feature of substance dependence are the physiological features. An increase in tolerance, such that the effect of the substance is less than it had been. The occurrence of withdrawal symptoms, or the use of the substance to prevent withdrawal symptoms. For the diagnosis of substance dependence, any two of these three are required to be present, and they should have occurred repeatedly over a period of 12 months or continuously over a period of 1 month, which is particularly applicable to certain short-acting substances and rapidly developing dependencies. The next substance use disorder is harmful substance use, or to give it its full title, harmful pattern of substance use. This also is a repetitive pattern of substance use which is developed, but where those central features of dependence have not yet occurred. However, for the diagnosis to be made, there needs to be significant harm to that person's physical or mental health to have occurred, or for that person to have manifested behavioural abnormalities such that the health of others is adversely affected. These two forms of substance use disorder, substance dependence and harmful substance use, have been developed from their counterparts in ICD-10. Substance dependence in ICD-11 is very similar to substance dependence in dsm-4, but it's quite radically different from the present notion of substance use disorder in dsm-5. dsm-5 made a decision to aggregate dsm-4 substance dependence and dsm-4 substance abuse, and the combined entity is a very broad entity which has been further subdivided into severe, moderate and mild. Work is being conducted to try to establish a crosswalk between ICD-11 substance dependence on the one hand and harmful substance use, and substance use disorder in dsm-5 on the other hand. Importantly, with regard to harmful substance use, social complications are not accepted as contributing to the diagnosis. And that's another distinction between the ICD and the DSM systems. The third form of repetitive substance use is a condition rather than a disorder or a health risk factor. This is hazardous substance use and has been included in ICD-11 for the first time. Although, as a concept, it's been accepted by the World Health Organization for more than 30 years. Hazardous substance use is defined as a repetitive pattern of substance use which is known because of the amount or the pattern of use to confer the risk of harmful consequences in the future, but where no harm has as yet occurred. So these are the three forms of substance use disorder which feature in ICD-11. They are also conveniently depicted as a pyramid, which is shown in this second diagram. A diagram that I find of great value for teaching students and trainees in the health professions. The other set of substance disorders are substance-induced disorders. These include substance intoxication and the various complications of substance dependence or harmful substance use. Firstly, substance intoxication is defined as a time-limited condition which reflects the acute pharmacological effects of the particular substance. Importantly, in ICD-11, as for ICD-10 and DSM-4 and 5, there are separate definitions for the wide array of psychoactive substances reflecting their different pharmacological actions and effects. Substance withdrawal is the second substance-induced disorder. It is a consequence of substance dependence, or at least somebody who has a pattern of repeated, lengthy and typically high dose of a particular substance. It is also a time-limited condition, though the duration of substance withdrawal may vary from a few days to several weeks or even 2 or 3 months. Again, specific definitions of substance withdrawal are included in ICD-10 for the various substances that are covered. Another diagnosis is substance-induced delirium. Here, the features of delirium are fulfilled, and they are temporarily related to either significant use or intoxication with a substance or a withdrawal syndrome. A new diagnosis in ICD-11 is single episode harmful use. And this has been introduced to capture the situation whereby a person has experienced significant mental or physical harm, including trauma, which is related to a particular substance, for example alcohol, but where there is insufficient information on that person's use of the substance for substance dependence, harmful pattern of substance use to be diagnosed, and where otherwise no diagnosis would apply. Then there are a series of substance-induced mental disorders. These include, for example, substance-induced anxiety disorder, substance-induced mood disorder, substance-induced psychotic disorder, and several others, including, for psychostimulants alone, substance-induced obsessive-compulsive disorder. These disorders are defined as the respective non-substance use disorders would be defined and described. But as I said, where there is a clear temporal relationship to substance use, and where typically the disorder has remitted within a few weeks of cessation of substance use. Although sometimes, for example, amphetamine-induced psychosis, it may be several months before that particular disorder has remitted. In the rest of ICD-11, beyond the mental health and addictive disorders section, there are many physical disorders which are classified and grouped in the respective organ or body system. So, for example, there are diagnostic guidelines for alcoholic cirrhosis, alcoholic cardiomyopathy, which are included in the gastroenterological and the cardiac sections, respectively. For the first time in the ICD system, in ICD-11, there are non-substance use addictive disorders. These include gambling disorder. In ICD-10, this was known as pathological gambling and was included in the obsessive compulsive disorders. But with the advances in our knowledge of the central features of gambling disorder, it has been moved to the substance and addictive disorders section. Gambling disorder shares some of the central features of substance dependence and is defined as a person having impaired control over gambling, gambling taking a priority over other activities, and gambling continuing despite adverse consequences. At present, the physiological features such as tolerance and withdrawal, which are recognised as features of gambling disorder in many studies, are not at present included in ICD-11, but are considered as important topics for further research. A new diagnosis which did not feature in any form in ICD-10 is gaming disorder. This may be defined as predominantly offline or predominantly online. And the greatest concern about gaming disorder and the rationale for its inclusion in ICD-11 is the fact that online gaming has become almost a worldwide phenomenon, particularly in young people and particularly in young men. And there is concern about the impact of excessive gaming, and evidence has now pointed to the existence of an addictive disorder, which is called gaming disorder, as features in ICD-11 or as features as a provisional diagnosis in dsm-iv when it was published in 2013. The central features of gaming disorder are also impaired control over gaming, the priority given to gaming over other activities and obligations, and continuation of gaming despite harmful consequences. As for gambling, phenomena which are akin to tolerance and withdrawal related to gaming are recognised, but it is regarded that there is insufficient information for these to be accepted as central features. And so, 25 years after the publication of ICD-10, we have a new version, ICD-11. A huge amount of work has gone into the development of the definitions and descriptions and the diagnostic guidelines. And more work is being conducted at the moment into the diagnostic performance of the diagnostic guidelines for substance use and addictive disorders. This is where the ICD-11 system exists at the moment. I can assure you it's been a mighty effort for all concerned, and there will be more work undertaken over the next 12 months, leading up to the formal publication next year, and also on an ongoing basis to make sure that ICD-11 fulfills the requirements of the healthcare community as a whole, worldwide. Thank you.